Upon returning to Florida in late 2009, it was as if by a knight in tarnished armor, dull blade, dented, broken, and fatigued by battle from slaying many dragons. Attempts to become reestablished were short-lived, and I spent some time jumping between Beverly Hills, Spring Hill, and Floral City, all in the Citrus County area of Florida. An attempt to adapt new skills as an antique furniture refinisher were short-lived, as only an hour or two per day of useful productive time, and not knowing when or if those times would come at all. Seizures, Parkinson-like tremors, speech impediments, Tourette-like outbursts. It was occurring to me that soon I would not be able to care for myself. An upcoming appointment with a Social Security disability attorney in Inverness was the last-ditch effort. There was neither the strength or the will anymore, and the first thing I told him when we met was, "This is the end of the road." At that time, it seemed there were 4 choices: nursing home, prison, hospice, or ultimately death. My attorney assured me and made me promise to keep seeing the doctor, stay away from the drugs, the bad ones, and stay alive. By Christmas time, I knew that the time had come to admit that I was incapable of caring for myself. I learned great humility that night. I finally admitted that I was nearly completely incompetent. Doing wasn't even in my vocabulary anymore, as waves of anxiety and dementia continued to spiral out of control. A rescue mission was formed by my mother, for me at 49 years of age, unable to function. How much worse could this possibly get? In 2010, my mother was one of several angels that appeared during this time of need. She gave me life twice, once when I was born, and again at 49 years old when she exclaimed, "You're getting another Lyme test," only this time with Igenix Lab. There was no strength or will to argue, and plans commenced for a flight from Tampa to Manchester, New Hampshire, where she had arranged an appointment with someone experienced in treating patients with Lyme. Christmas came and went, and the appointment loomed ominous. This angel number 2, a Lyme-literate doctor, or LLMD, gave it to me straight. Based on the evidence of the symptoms alone, it was believed I had a 90% plus chance of having the disease, but that the lab tests through Igenix, who claim a 95% accuracy rate high above the norm of other labs like LabCorp and Quest, would verify this. Blood was drawn at the office, and I was sent home to wait the 7 to 10 day lab response. The hour was getting late indeed. Diagnosis confirmed: neuroborreliosis, advanced late-stage Lyme disease. "You have evidence of old Lyme," the doctor told me on the phone. The appointment was made to obtain several antibiotic prescriptions, Biaxin and Plaquenil. The doctor leveled with me about the rough road ahead. She explained that treatment would cause a Herx reaction, a result of inflammation from severe die-off of the spirochete. And this was going to take a long time. How long? Months. Years. My doctor was good about setting the terms for recovery and creating realistic expectations. With the acclaimed Lyme documentary Under Our Skin as part of the first week treatment, we obtained a copy of the DVD and began to learn the hard truth about Lyme disease and the many myths that perpetuate misunderstanding about the disease. Caretaker with one priority: to help get well again. For anyone in the late stages of advanced Lyme disease, doing anything can often be an unrealistic challenge. Simple things we take for granted, eating, dressing, showering, even just breathing, can become huge challenges. Speech, communication, and reasoning can become severely impaired. The caretaker has a very important role in the recovery of the patient, but it takes all three to increase the probability of saving someone with Lyme: an advocate, an LLMD, and a caretaker.